The November 16th, is that today? Thank you. The November 16th Benefits and Insurance Committee will come to order. Call the roll, please, ma'am.
Commissioner Boyd.
Here.
Amber Brown. Suzette Couples. Holly Deering. Brian Gaither. Mary Hickerson. Lois Miller. Commissioner McAdoo. Commissioner Phillips. Shantae Sherrill. Michael Smith. Steve Spence. Sonia Stevenson. Eric Tutobeni.
Thank you, Susan. Madam Vice Chair, have you had an opportunity to review the minutes of the previous meeting?
Yes, sir.
We have a motion to approve the minutes. Do we have a second? We have 2 seconds. You can pick which one, Susan. I'll leave it up to you. All those in favor of approving the minutes say aye. Aye. Opposed? The ayes have it. The minutes stand approved. This portion of our agenda includes public comments. We have one individual who signed up for public comments. Is Mr. Chuck Barnes present? Yes. Chuck, if you'll come forward. You have 3 minutes to speak, to share what's on your mind, and it must be insurance or risk management related. Yes. Okay?
31-year employee of the Rutherford County Sheriff's Office. I'm here today to request that this committee reverse its decision and vote concerning the removal of the stipend insurance program from certain portions of the eligibility and benefits documents for retirees. When this vote occurred in late 2022, it eliminated this option for some of the previously eligible employees. I know that the stipend insurance plan does not work for all retired employees, but no one insurance plan does. This stipend plan would meet my insurance needs after retirement, and the stipend could also benefit and be useful to other employees, such as our military veterans. I have spoken with several, and they have relayed to me that they would choose this stipend plan to supplement their insurance programs that they get from the federal government. As a 31-year Rutherford County employee contemplating retirement, I wish that the employees would have been notified of the intention to change the benefit eligibility program by this board. With that notification, we might have come forth and had a conversation that includes this matter. I wish to thank you for your time and attention, and I would like to see this committee come to the conclusion that the employees need more options for retiree benefits and not fewer. I hope that this committee votes to return the stipend plan back as an option to the retiree groups that were previously eligible prior to 1/1 of this year. Thank you.
Mr. Barnes, before you leave, I failed to have your mic on when you came up. If you could announce your name and your address, please, for the record, I would appreciate it. Thank you.
My name is Chuck Barnes. You can put 940 New Salem Highway as my address.
Thank you, sir. Thank you very much. Mr. Barnes is the only one listed today for public comments, and I will say this, I believe we've made it a change to the agenda, and we'll be discussing this later on in the agenda. But for now, we're going to go to item 4. That's the financials. Mr. Elam, can you present those for us, please?
Yes, sir. For the 264 fund, and 266 fund, if the committee doesn't object, I'll just give you there's September. You have September and October both on your iPads, but the October numbers are more up to date. So I'll just read the October numbers unless there's an objection. For the month of October 2023, revenue you have $1,739,781. Expenses, $1,670,499. Revenue less expenditures, you have a positive $69,282. The total for the calendar year, you have $20,049,079. Expenses, $16,591,849. Revenue less expenditures, you have a positive $3,457,230. And for the fiscal year, the revenue totals $7,379,932. Expenditures, $7,635,623. Your revenue less expenditures for the fiscal year is $255,691. For the 266 fund, for the month of October, we had $25 in the workers' comp. For OJI, we had $50,335.67. And your total for the month of October is $50,360.67. Year-to-date total, workers' comp, $4,677.14. OJI, $149,874.06. And your total for the year, $154,551.20. That's for the fiscal year. And that concludes my report, Mr. Chairman.
Thank you, Director Elam. Are there any questions for Mr. Elam? Seeing none, the chair will entertain a motion to accept. We have a motion to approve. Do we have a second? We have a second. Any further discussion or questions? Seeing none and without objection, Susan, if you'll call the roll.
Commissioner Boyd? Yes. Suzette Couples? Yes. Holly Deering? Yes. Brian Gaither? Yes. Mary Hickerson? Yes. Lois Miller? Yes. Commissioner McAdoo? Yes. Commissioner Phillips? Yes. Shante Sherrill? Yes. Michael Smith? Yes. Eric Tutobeni?
Yes. Thank you. Susan, you're now going to present the OSHA report, I believe?
Yes, sir.
Thank you.
This is a report for October of 2023. I believe you also have September's on your iPad for this report as well. If not, we'll get that to you if you need it. So for October's numbers, there was 24 incidences. That brings our year-to-date total to 201. Out of that 201, there was 142 that were OSHA recordable, with 28 lost day claims, 88 restricted day claims, and 26 other recordables year-to-date. On the next page, you'll see this year's total of 201 compared to 2022 of 153 and 2021 of 145. We have been giving you 2019 numbers as well, since that was a pre-COVID year, and for the same time period in 2019 year-to-date, we were at 224 incidences. Our incurred dollars for this year so far is $601,000 compared to last year at $555,000 and 2021 of $484,000. Of the 24 incidences, there were 17 at the Board of Ed, 7 at County General, and all 7 of those were at the Sheriff's Department. And that concludes my report.
Thank you. Any questions? My apologies. Any questions or comments for Ms. Thompson on the OSHA report? If not, the chair will entertain a motion. We got a motion. Do we have a second? We have a second. Any further discussion, comments, or questions? Without objection, all those in favor say aye. Aye. Opposed? The ayes have it. The report stands approved. Thank you, Susan. Ms. Lovett, there you are. I didn't see you. I was looking for you. I thought, I hope you're here. Signal Wellness Update. Thank you.
Good afternoon. Today these numbers are up to date from October, and November's included. For everyone that has completed all 3 of their Motivate Me incentives, we are currently at 850. And I thought maybe I should bring this up just so some people know that there is certain departments that do on-site screenings like flu shots and so forth. So this number does not see the whole of everyone that has completed all their health preventative screenings. This is just the ones that's gone through claims. So there are overrides from certain departments, so there is a larger number there that would that have met all 3 preventative goals. And comparing this is every quarter I try to give y'all an outlook of where we are from last year at this time, and I did take out Board of Ed. And so we are down a little bit right now based off this, but that is also due to typically we would have 3 mammogram buses come out, and because St. Thomas mammogram bus has been shut down, been having issues since last year, end of last year, we were not able to follow through with those. And also, as you see, our numbers are down in that area a little bit, but also you'll see the flu shots. is a big significant one, and typically we'd have flu shot drives, but because of all the transitioning with MedPoint Clinic and so forth, we decided to just provide them with all the local clinics that they are able to use in place of that. And unfortunately, that looks like it's maybe brought our numbers down a little bit too, so that would be some of the reasons why we might have a difference in goals met there. We had our last 2 podcasts of the year recently, saying we're staying consistent with that and with the numbers on that. We ended that third quarter wellness challenge in October. We had a prize raffle giveaway, and that was a virtual one. That went well. And we just recently wrapped up for fourth quarter, our lunch and learn that we had. It was about knowledge and nutrition. We had a vendor come out with one of the programs we use and had a really good feedback with that, and 2 registered dietitians. And it's one of our biggest lunch and learns, even from the last one, which was our second biggest one. And that will be the end of the year. That's the last event that we will be having for this year. That will conclude my report.
Thank you, Ms. Lovett. Do we have any questions or comments for Ms. Lovett? Seeing none, thank you very much. That's nice. Oh, excuse me, Mary, you're going to have to, you promised you wouldn't speak, and so I don't look over that way because I know you're going to speak, and you just silently, stealthily raised your hand. That's not going to work, Mary.
Okay, sorry about that.
Ms. Lovett, if you will help Mary and I out, we would appreciate it.
Actually, and I appreciate Ms. Liz, but it's more or less, and it may be something that comes up later on. We're getting at the end of November here. We've only got December left, and Ms. Liz is, she's leaving us at the end of the year, and Ms. Lee is already left, so I'm really looking for some direction for our county employees and selfishly for my highway department guys. Where are we at on getting somebody, Cigna, to be able to talk to, and how are we going to keep this wellness? Because I know I had mentioned that the wellness and how are we going to keep the points going with doing away with the clinics and stuff like that. So we need to, if we don't have anything, we need to be thinking about how are we going to keep this wellness going, because we're headed in a good direction. And then selfishly, who's going to be our Cigna police call and help them with a claim or something like that? Do we have something in the works, and it just happened to be that it falls at the tail end of Ms. Liz's report?
Mr. Elam, would you help us out with that, please, sir?
So actually, today is Liz's last day.
Oh, well,
She's taking some additional time off before she goes to her new Cigna job. And then I have also met in the last few weeks with Mr. Huffman, which could not be here today, but we do have a person coming in that's going to have combined account to where they would both be wellness and engagement together. So, so we've gone down from 2 down to 1 for the year. And we have met a couple of times and several conversations to see how this is going to work, because I share your same concerns. Without the wellness program, I think our claims go up, and I think that there's a lot of value to it myself. So I know that within the Cigna organization, they're looking to see for Rutherford County. Rutherford County's also assigned a person, what's Candy's last name? Turner. So we still have a full-time person, Candy, that helps. So if you have any claims, questions, EOB questions, anything like that, she's still assigned to, she's not on site, but she's still assigned to Rutherford County to answer any of our questions. And then we'll also have someone else come in to do the engagement and do the wellness together, combined.
okay, thank you. Before we go any further, Ms. Liz, thank you, and we appreciate it. And me from the highway department, and how I'm always talkative and got questions and everything. We appreciate what you have done for us and where you have led us. And these numbers have changed and went up, believe it or not, although we're down a little bit right now, but they've went up. And your little podcast and actually getting the highway department guys involved in something, so kudos to you, and thank you very much for what you've done for us, and best wishes and good luck.
I really appreciate that, and I didn't know if it was appropriate to tell people it was my last day, but I really appreciate the Rutherford County allowing me to do this for them, and it's been a great experience, and I definitely met some awesome people and seen some great internal stories that people have done. It's been a great thing.
Well,
I appreciate it.
Ms. Lovett, on behalf of the mayor's office in Rutherford County, we do appreciate the work you've done, because when we've got healthy employees, we've got, I know it sounds corny, but we really do have happier employees, and you've been a big part about promoting good health practices, and we appreciate the work you've done on that, and thank you very, very much. On behalf of Rutherford County, we appreciate it.
Thank you. That's very
Next on our agenda, without objection, is the MedPoint report. Ms. Wilson.
Good afternoon. So I have both September and October's reports to go over with you all. If you will turn to page 3 of the September report, I will try to keep it as brief as possible and still fill you in on all of the details. So the New Salem MedPoint Clinic saw 156 visits in the month of September, with 134 of those being unique members. On page 4, in September, we saw 15 children, which made up 10% of the visits, 128 employees, which made up 82% of the visits, and 13 spouses, making up 8% of those visits for the month. Our visit appointment type summary, there were 21 members that had more than one visit in the month of September. The visit summary by day, there were 20 scheduling days in the month of September. The clinic was closed for Labor Day on September the 4th. Our virtual visit review, there were 3 virtual visits in the month of September, so still down below 2% of the visits being virtual. Page 8, you will see the in-person versus virtual appointment trending summary. You can see that the virtual appointments have remained low across the year. Our referral summary for the month of September. Our top 5 referral specialties were gastroenterology, pulmonology, physical therapy, otolaryngology, and dermatology. And then for the financials for the month of September, the total operating cost was $36,376.53. There were 134 unique members, 1,932 employee count with a PEPM of $19. On page 13 for the population health analytics, September male highest percentage of BMI was overweight, and female highest percentage was in the obese class 1 category. Our September diagnosis review, the top 2 diagnoses for September were encounter for general adult exam, and the second one was pharyngitis sinusitis. Welcome to fall and winter. And then on page 15, the visit demographic summary. In September, 53.9% of the members seen were female. The male and female age range were 40 to 49 for the highest population seen. And then we will move on to our October review. In October, we saw 131 visits, with 109 of those being unique members. Our visit summary by member type, there were 11 children seen for 8% of the visits. 102 were employees for 78% of the visits. 18 were spouses for 14% of those visits. Our visit appointment type summary, 16 members had more than one visit in the month of October. Our visit summary by day, there were 22 scheduling days in October. Our in-person versus virtual, we did have a bit of a spike. In October, we saw 4 virtual appointments, for 3% of our appointments being virtual in nature. Page 8 is the in-person versus virtual appointment trending summary. On page 9, the referral summary, the top 5 referrals: endocrinology, urology, sleep medicine, otolaryngology, and OB-GYN. And then for the financials on page 11, October's operating expenses was $31,797.66, 109 unique members, 1,933 employee count for a PEPM of $16. And then we will move on to population health analytics on page 13. So October flipped from September. Our male highest BMI was in the obese class 1, and the female landed in the overweight category. Our top 2 diagnoses in the month of October were fibromyalgia and then streptococcal pharyngitis. Our visit demographic summary on page 15. In October, 60.31% of the members seen were female. Male and female age range, again, this month of October, were 40 to 49. And that concludes my presentation.
Thank you, Ms. Wilson. Are there any questions or comments? Yes.
I just have a quick question. I think this is the first time we've seen fibromyalgia as a top diagnosis category. And so is that by number of people or cost? How are you calculating that?
It's by number of visits, so not necessarily number of people.
Okay, so it could be 1 or 2 people with multiple visits. Okay, thank you.
And thank you, Ms. Miller, for bringing that up. Why the sudden rise in that as a diagnosis that you're receiving visits? That seems odd to me. Do we have an understanding of that?
So it does seem odd. I think it has to do with, sorry, I don't know which way to look.
Sorry, you're doing fine. I can hear you back here.
I think it has to do with the number of visits that a patient had with that particular condition, because they do require some different testing and treatments.
So it would be the same patient going multiple times, and so it's counting each one of those visits. Would that be accurate?
Yeah, as much as I can say without giving any information away.
Yes, I do not want you to do that either. Thank you for being careful.
Yes.
Any other questions or comments? Seeing none, we'll accept the report without objection. Thank you very much.
Thank you all.
Item number 8, Mr. Elam, about county general vacancy.
Yes, sir. I need to announce that there will be a county general vacancy effective January 1. Well, we will fill it January 1, 2024. A couple of things I want to mention to anybody that's watching this that might be an applicant. As you know, this will be televised on RCTV. There is an absenteeism resolution that was passed by the commission, and anyone absent for 3 consecutive meetings or a total of 4 absences in a calendar year will be replaced. Also, for the applicant, you must complete an application, be enrolled in a county medical plan, and submit a letter of recommendation from the department head or the elected official with the application. It must be with the time that it is submitted. This application and the letter of recommendation can be returned by Monday, December 18th, 2023 at 4 o'clock. You can send it through benefits@rutherfordcountytn.gov. You can mail it, but it must be in the office by the 18th or in person. Location is 303 North Church Street, Suite 1. Each qualifying applicant will be considered at the December 21st, 2023 insurance meeting. And I would ask also that any applicant be prepared to speak to the committee if it's not you don't have to, but it is a recommendation that you be prepared to answer some questions.
Thank you, Mr. Elam. Any questions for Director Elam on the vacancy? Seeing none, without objection, we'll accept. We go to the change on the agenda, which is item 9, which is now the retirement benefits discussion. I think this is a result of the public comments. Is that correct, Director Elam?
Yes, sir.
Okay, so if you will kind of lead us in that discussion, I would appreciate it. And thank you for the addendum to the agenda.
Yes. So one clarification, so everybody understands, with this not being a standing committee, for someone to speak for public comment, you have to have the item on the agenda. So this item was added to the agenda to make sure that we were in compliance with that prior to the meeting. And so based on Mr. Barnes's comments, in the October meeting of 2027, October 2027 of 2022, we didn't change any of the eligibility. We did change the stipend to be removed from the plans except for the last 2 buckets in the plans. And in that plan, the last 2 buckets is if you have been here less than 6 months, or if you have been here 6 months up to 7 years. Now, this eligibility was put together 2010, I think. Is that correct, Mary? There was a committee of people that came together. I can tell you my first day when I came on here and I looked at this, I thought, my goodness, this is a lot. But then, after you study it, review it, you understand why things were done, trying to make sure that in trying to reduce some of the costs for retirement, and you see why the buckets were developed. And if you remember, the Board of Education left our plan in 1/1 of 2023, and so we had to do some updating. And one of the things in the process of doing this is the retirees went to the Medicare Advantage plan, Cigna Medicare Advantage plan, so some of the language had to be changed. And while we were doing that, we also discussed the stipend plan. So the last 2 buckets that I think on this is the first 2 buckets, where it's 6 months eligibility, up to 6 months. That group of people, once you meet whatever that eligibility is for you, they just get the stipend up to the age of 65. The next group, 6 months up to 7 years, you get the stipend at pre-65, and then you can go on to the retirement plan at post-65. Prior to that, you had the option of going on the medical plan or taking the stipend in the other buckets. So the reason why we sat down and we looked at it while we were making this change for the Medicare Advantage plan and changing some of the language and looking at whether or not we wanted to take a look at the stipend plan is because, and there are some exceptions, but there's a lot of people that, let me back up. Stipend account. It's a health reimbursement account. It's not an insurance plan. So a lot of people look at it as an insurance plan, and it's a county plan of one of the two choices. What the county does is they just put money into an account, and it becomes a plan that is regulated by the federal government. And so whatever changes they make, it's handed down to the person who is in that plan. It's not a Rutherford County plan, self-funded plan. The stipend plan's not, or the stipend account is not. It's a Freedom Choice stipend account, and it's also not an account to where someone has just put $1,000 into your account every month. It is used to go into account to where you can draw out of it based on your receipts. And so we have, there's a lot of misconception sometimes when someone chooses the stipend account, because they start coming to our office and say, hey, I've never handled these receipts, I've never handled these EOBs, and they come in, they're like, you know, can you help me with it? And technically, they are off our plan. They're on a stipend plan, and there's also some other things that to clear up. The eligible expenses, you have to be on a Medicare. You have to be on an insurance plan that is post-tax, not pre-tax. Your county employee active plan is a pre-tax plan. This would have to be a post-tax plan to be able to apply it towards those premiums. That's something else that people, again, we go over that with them, but it depends on who they talk to before they got to us sometimes, whether or not it was conveyed correctly. And then the stipend plan, the other thing about the stipend plan, the stipend account. The stipend account ends if upon the death of the employee. It doesn't carry over like our pre-65 health insurance plan does for a surviving spouse if they meet that requirement, that eligibility. So I don't think it is a as far as budget, I don't think it has much effect on the budget as far as whether you do the stipend or whether you put it back in or you don't put it back in. I just don't think there's going to be much effect to it. And the other thing is, it's hard. The difference is you pay them a stipend and then they're responsible for their own claims. With the county self-insurance plan, they pay a premium and then we're responsible for paying those. It's what we're responsible for doing. So that's kind of a summary of the stipend account, health reimbursement account.
Any questions for Director Elam on this?
I have one.
Yes, Mary, you're recognized.
Thank you. In reading on one of these, it just caught my eye without having done a whole lot more research before. This says the health reimbursement account of $1,000 per month or adequate rate. Are we paying anybody's less than $1,000?
I'd have to go back and look, because I don't recall that anybody's less than 1,000.
Okay, so with that being said, what was our, and yes, I was here during all this, so where would we have come up with $1,000 per month or adequate rate? Where would we ever get to an adequate rate, or is it just always going to be? I'm saying going to be because I know it's not right now, but just for the sake of purposes, because I'm sure, well, I know for a fact we have some on this plan. So would we ever pay less than $1,000 based on adequate rate? So if not, then we need to look at, if you have a pre-65 retiree wanting the stipend account, the most we would pay out would be, and I say we because I write the check that goes for my retirees, whether they're pre or post, would be $12,000 in a calendar year. And just right off the top of my head, I have, because I write this retiree check, that's $1,000 if they take the stipend, whether it was a husband, child, wife and family, or the whole kit caboodle, it was $1,000 flat. So I know for a fact that some of my pre-65s that I write a check for that are employee plus spouse and or family, the cheapest one of those is like $960 for round numbers, $960 or $975 a month. And they have like the copay plan. So there's not much difference on this, but I'm trying to figure out, because I've constantly always wrote $1,000 for the ones that have the stipend account, and this references an adequate rate. Would we ever get to an adequate rate, or do we just need to say it's $1,000 and be done with it? Because it looks to me like it needs to be less than $1,000 if I'm paying for a husband and a wife, you know, $975-ish for a copay plan for them.
Your adequate rate is going to be close to $1,000. Again, we'd have to go back and look at the rates and where each person would be in that to see if they'd be under that 1,000 or at that 1,000.
So really, when it's figured on that, it's just figured on $1,000. It doesn't matter if that person was retiring being a employee or employee spouse or employee plus family. It's basically $1,000 for the employee who retired, no matter whom he was covering before retirement. Okay, so I have a question for Michael.
That's good, because Michael's got a question too, so
Okay, well, we'll let Michael ask.
Mr. Smith, you're recognized.
I believe all questions should be directed to Director Elam. How many, when we did this back in October, November, how many people, if I remember right, it was somewhere around like 15 or 20 people? Does that sound right, that this affected?
We have at the present time 21.
That was close, okay.
You're close, yes.
With that being said, and the one thing to look at this is that 21 still has BOE employees in it because they fall under the retiree heading, so they were able to stay and not go to BOE. How would this affect, and I'm assuming I'm going to answer it in my question, with BOE having left, we're actually only looking at probably 1,700 to 1,800 employees that potentially, and not all of them are going to hit this, but you're looking at now 1,700 or 1,800 employees that would have this option potentially, you know, if everybody got the option, instead of the whole 6,500 plus counting BOE. So this potentially could be a good add, because in my mindset of knowing my population of our 72 employees, this would help some potentially of making the choice of being able to go that route instead of, because they might not meet some of the other buckets to do like the post 65 or something like that. We have to realize that if we put this back in place, that it's for a lesser number than, for lack of better terms, than whom we took it away from, if you will. So,
Mary, is that your question that was directed at Mr. Smith, because you were looking at Ed Elam?
well, I thought we were asking Ed. So, I mean, are there any way to know, I know, worst case scenario, if we put this back in, do we know what this would hit the budget at? Rough guesstimate. I ain't
Yeah,
holding nobody to
that's a
nothing.
definite question for
That's a
Michael
Michael
Smith.
question.
That's definitely a Michael question. Mr. Smith, can you help us there? Just ballpark it.
So I'm not going to be able to give you an answer because that's going to depend on a lot of factors. Because let's say that individual right now takes the county insurance. For example, right now they don't have an option. When we eliminated this, they take the county insurance. It depends on what that cost is to the plan, right? So it's not going to be 1 year. This could actually save us money some years, and some years it could cost us money. Depending on how many, and I don't know off the top of my head, that's why I asked that question. I knew it was around the 15, 20-ish mark with BOE, so I think it would depend on, one, how many of those are BOE employees, because as they roll off, to their own, it may not cost us any money, and it could cost us some. I know that's not the answer you're looking for, but that's the only answer I could give you on the fly today.
Michael, is there a way that you could ascertain the cost of the 21 affected by the next Risk Management Committee meeting? An approximate number.
We could come up with an estimate.
That's what I'm looking for.
I tell you what, I'd like to make a motion that we explore this and bring back a recommendation at the December or Insurance Committee meeting.
Is that a formal motion?
I'll second that motion.
We have a motion and a second. Any discussion or comment on the motion? Seeing none and hearing none, and without objection, I'm going to call the roll on this, please.
Commissioner Boyd? Yes. Suzette Couples? Yes. Holly Deering? Yes. Brian Gaither? Yes. Mary Hickerson? Yes. Lois Miller? Yes. Commissioner McAdoo? Yes. Commissioner Phillips? Yes. Shantae Sherrill? Yes. Michael Smith? Yes. Eric Tutobeni? Yes.
Thank you, Susan. Motion passes. We're now to other business, the 2024 meeting dates. Ed, you want to start with that, please?
You should have before you the 24 meeting dates. The remaining date that you have is December the 21st of 2023, January the 25th of 24, February the 29th, March 28th, April 25th, May 30th, June 27th, July 25th, August 29th, September 26th, October 31st, and I will mention that Ms. Hickerson has brought it to our attention that is Halloween, and we normally don't meet in October, but we put a date in there just in case, and we'll try to keep it brief if we can. And then November 21st and December the 19th.
Thank you, Ed. So without objection, we'll accept those dates, and then, of course, we can always amend at a later time if we need to. I have one other piece of business. There's a little bit of disagreement. It's not significant, but there's a little bit of disagreement between the chair and the director about what constitutes what should go on the agenda. And so we've mutually consulted Nick Christensen to get that sorted out, because state law required us to have public comments beginning July 1 on all committee meetings. And as usual, the state law can be somewhat vague in the language they choose to use and how we're to interpret that. So we're going to reach out to Nick and get some clarification on that. The position of the chair is that if the item that wishes to be spoken or addressed by public comments has to do with insurance or risk management, it effectively is on the agenda. And I understand the director's point of view that if it's not specifically listed as an itemized part of the agenda, it should be. So we're going to get that straightened out. And so that's why earlier there was this little bit of back and forth, but we're going to get that straightened out.
And one other thing is that we have in question is, can you suspend the rules and allow that person to speak regardless?
That is, I know you can suspend the rules, but that's something we don't particularly like. The chair would not particularly like to start doing, because once you start going down that road, Chairman Phillips, you know it's a slippery slope. Your microphone, please. You're recognized. Thank you.
I'm not sure what the legalities are, but if someone wanted to suspend the rules to allow for public comments that were not on my agenda, I would not allow it.
So, and in that regard, we want to get clarification from the county attorney on exactly what the statute means and how it's to be applied.
I already have for the county commission.
Good, excellent, thank you. Is there any other business before the committee? Seeing none, we stand adjourned.